When I first see a patient with a neuroendocrine tumor, there's several factors that I look at. One is this tumor localized? Is this something curable? Or has this spread beyond the original site? And my goals vary. So I ask all of my cancer patients, I ask myself the same three questions about any cancer patient that I see. Is one, can this patient be cured? Two, if they cannot be cured, do I have some sort of treatment that is going to at least improve or at least maintain their quality of life? And three, can I make this patient live longer? So those are the three things that come to mind right off the bat. Neuroendocrine tumors are a little bit different than some of the other traditional cancers that we see. Most of the time when I see patients with a neuroendocrine tumor, the cancer is already spread. And I know at that point that this is going to be a long journey for the patient, and the hope is to, again, maintain or improve that quality of life and keep them going as long as possible. There's several different ways that we do that in neuroendocrine tumors. First thing, right off the bat, when I look at a patient, I look at what they look like. Can this patient tolerate any sort of therapy? And I say, well, what kind of therapy do I have to offer this patient? And some of that depends on the pathology. Is this a slow-growing tumor that I have time to send to different specialists and do different sort of treatments? Or is this a very high-grade, poorly differentiated tumor that I need to start the patient on chemotherapy tomorrow? So that is the first thing I look at. Many times with the neuroendocrine tumors, they tend to be on that slow-growing side. I work in a specialized center that has a multidisciplinary approach. We have a tumor board every week where we talk about our patients and come up with treatment decisions as a team. And that's very, very important in this disease. So I work with my surgeons, my GI docs, my radiologists, my nutritionists, and we all get on the same page and figure out the best way to move forward with treatment.